You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, I'm Janet Kaplun, editor and founder of Hispana Global, coming to you live from the Baptist Health South Florida newsroom. As you can see, we have gone pink. I'm wearing pink, we have pink lights, all of this in honor of Breast Cancer Awareness Month. Breast cancer, unfortunately, will affect 1 out of every 8 women in the US in their lifetime. Although we have been making huge strides every year in treatment and prevention, it is still expected to cause more than 42,000 deaths this year alone. That is why we really feel this topic is so important. And we want to not only raise awareness, but we want to dispel so many myths out there because knowledge is power. And that's why we decided to invite Dr. Jane Mendez, Chief of Breast Surgery at the Miami Cancer Institute, because she knows more than anybody all the facts, and she's going to help us dispel all the myths surrounding breast cancer. Welcome, Dr. Mendez.
Thank you for having me, Jeanette. It's a pleasure to be here to dispel some of these myths.
Yes, it's so important, and you do so much. You do so much for so many women, for so many families, because this disease not only affects the patient, it affects everybody surrounding them, everybody who loves them. Why do you think that this information and misinformation can be so harmful?
It can be so harmful because women can have a sense of easiness and I don't need to forget about it. And that might stop them from taking action if they find an abnormality. So it's important to, as you said, empower yourself with education so you really know the facts. And when you see something, you can take action and do not delay it because early detection is key, as you know.
Yes, that is so important. Early detection, knowing your risk, but also knowing the facts. And I want to invite everybody who is tuning in to leave their questions, their comments. These myths that we will be addressing probably will answer most of your questions, but we always want you to be a part of this chat with Dr. Mendez. So if you have any questions or comments, we will address them at the end because it's important that you get all the information straight from Dr. Mendez. So, Dr. Mendez, let's dive into myth number 1. Are you ready?
Yes, I am ready.
Okay. If you don't have a family history, then you don't have to worry about breast cancer.
That is not true. Turns out that 85% of women with breast cancer, it occurs sporadically, meaning that you're the first one who has it in your family, nobody else. The 2 main risk factors for breast cancer are being a woman and getting older.
Oh my goodness. Okay, yeah. So just by living and breathing, you are already a risk factor.
Exactly. So fact number 1, this myth.
Okay, let's go to myth number 2 that I've heard so much. Caffeine increases your risk of developing breast cancer. Myth or reality?
Myth. There's no link and no evidence to support that breast cancer is due to caffeine. However, we know that there's an association between caffeine, let it be chocolate, tea, sodas, coffee, and breast pain. So when the women come with breast pain, I have to inform them about this association, but no association between caffeine and breast cancer. So enjoy your cup of coffee.
Well, that's good to know, but it can cause, aside from pain, breast tenderness, correct?
Yes. So that is, and fibrocystic changes tend to be increased with caffeinated products. So that's a strategy when women come with breast pain or tenderness, we will refrain from caffeinated products as much as possible.
Okay, good to know. So I'll continue enjoying my morning coffee as usual.
Absolutely.
But here's another myth that I have heard all over the internet, and many friends as well have told me. Does the use of deodorant increase your risk of developing breast cancer, especially if they have aluminum?
No evidence to support that myth either. So
Okay.
no issue.
So there's no need to go all natural unless you want to. It's not medically necessary to dispose of certain deodorants just because you've heard about this rumor, correct?
Correct. Absolutely correct, Jeanette.
And what about wearing an underwire bra? This is another topic that I see coming up constantly. Does wearing underwire bra increase your risk of developing breast cancer?
No evidence to support that fact either. And certainly we need to look good. So a little underwire bra helps every so often, right? When you want to accentuate the silhouette. But again, little caution. Underwire bras can be associated with breast pain or breast tenderness as well. So, but it's not uncommon for women to come with complaints on the lateral aspect of the breast on the sides where the wire ends, or in the inner part of your breast where the wires end. So therefore, when women come with breast complaints, we need to find out whether they're using underwire bras or not, because that may be a cause for breast pain.
Okay, so just to keep an eye on it, but it's not going to be a cause of breast cancer, but it can cause
Absolutely.
discomfort, and that might be associated with other things, but it's not a cause of breast cancer.
Correct.
Okay, so another question, because people tend to think that breast cancer always comes in the form of a mass. Is that always the case?
Not true, Jeanette. And that's why we have to be very vigilant, and very important for every woman to know their body and what's normal for them, because everybody's different. But breast cancer may oftentimes present as skin changes. It may present in changes in the area of the axilla or the underarm. It might present with nipple retraction, nipple pulling. It might present with just an area of tenderness, or even some asymmetry, meaning you see that all of a sudden your left breast is larger or smaller than what it had been, or vice versa. So that's why there is no substitute for every woman to know what's normal for them, so that they can be in tune with these slight changes in their breast exam.
So anytime that you do notice a change, then we should consult a doctor. That's the most important advice, correct?
Absolutely, absolutely. And to be familiar with what's normal for you, so then you can detect these changes promptly and then
Okay.
seek medical attention.
Now, the next myth is that it's one that's related to something that we've been discussing, which is breast pain. Does breast cancer always have breast pain associated with it?
No, and that's again one of the major things we need to be concerned about, because usually by the time breast cancer is associated with breast pain, is already in more advanced stages. So again, if you feel something, say something, get the appropriate evaluation, because breast cancer in the early stages where we want to detect it usually does not hurt.
Okay, that is an important fact to know, and an important myth that needs to be dispelled. So please just be aware of the facts. And speaking about facts, I've heard that the smaller the breast size, the smaller the risk of developing breast cancer. Is that true, or is that another myth?
Another myth, Jeanette. So certainly, irrespective of breast size, you have to follow the screening guidelines, and you have to certainly be vigilant, because having smaller breasts does not save you and does not give you lower risk of developing breast cancer.
Okay, so
Yep.
it's not related whether you have small, big, it's totally different. So
Remember, two main risk factors: being a woman and getting older. And we cannot control either of the two. Yes.
That's why we have to be so vigilant.
All times.
There's another myth circulating around the internet that increased cell phone usage is increasing our risk of developing breast cancer. Is this really a myth, or is there any facts that might support it?
A myth as well. And we have no evidence to support that either. So a myth, happy to say, because we depend on cell phones now. It's become such an important component of our lives. So a myth.
It's crazy, because we really feel that a part of us is missing if we leave our cell phone at home or if we don't have it with us constantly. So at least this will give a lot of people a sense of, okay, I can breathe and still use my cell phone. But there's another myth, and that I have actually known about this myth for a while, that it is a myth, but I keep seeing it, that exposing yourself to radiation during mammograms increases your the breast cancer risk. So Dr. Mendez, can you settle this for once and for all? Does the radiation from a mammogram increase your risk?
Absolutely not. The dose of radiation that we get exposed to with mammogram is really small, especially now that we have the 3D mammography, and that is even less the dose of radiation that it was even with the mammograms before. So it's much more of a risk not detecting a breast cancer in a timely manner than the risk that a woman has, even cumulative over her lifetime, of getting those mammograms once per year, or even any additional images that are recommended for further workup. So it's important to get your mammogram. The radiation dose will not increase your risk, and it would be to your detriment not to have it done and have then a delayed breast cancer diagnosis.
And of course, I know that the guidelines might vary depending on your risk factors, aside from being a woman and aside from celebrating a birthday every year. But what is the current age guideline for mammograms for people who are considered at an average risk?
Yes, very good question. And as you know, that has been a very controversial area as the guidelines have changed over the years. But the most current guidelines, and what we actually advocate here at Miami Cancer Institute, we want every woman 40 and older to get a mammogram every year. As you know, early detection may save lives. For women that are not average risk, then it's part of a conversation. If they have either family history or other risk factors that increase their risk, for the average woman, just as you asked me, 40 every year annually.
Okay. That it's also very important for women to understand that aside from this misconception that getting a mammogram can increase your risk, right? That we have already established that it is not true. A lot of people also think that it's very costly to get a mammogram. And especially during the month of October, many hospitals, many organizations, many doctors, many cancer institutes like the Miami Cancer Institute are actually trying to get more people to set up their appointments and to go and get the mammogram. Can you tell us about what the Miami Cancer Institute and what Baptist Health South Florida are doing specifically for Breast Cancer Awareness Month?
Yes, as you said, during the month of October and also May, around Mother's Day, we like to emphasize the importance of getting your mammogram done. And as you alluded to, we have discounted rates so that incentivize the patients to come get their mammograms done. And obviously now a lot of people are slightly hesitant about getting their mammogram within COVID, but I can assure everybody that we have all these safety guidelines. It's very safe to get your mammogram done. We're following all the requirements for distancing, mask wearing, et cetera. So do not delay getting your mammogram and take advantage, especially in October, given the discounts and incentives to get your mammogram done if you need one, because it's really important to take care of yourself.
It's super important. And actually, the Miami Cancer Institute also has a breast prevention clinic. Can you tell us a little bit more about what work is done at the clinic?
Yes, that's a very interesting concept, Jeanette, and one that we started in March of this year, because there are many women who, on the basis of their family history or certain findings on their imaging or certain pathologic conditions, certain genetic predisposition, they might be at increased risk of breast cancer. We want to target these women so we can put them in a special tailored program where it might include exercise, nutrition, genetic counseling as needed, and appropriate referrals after their evaluation, so we can really stratify the risk and have prevention strategies for these particular women so that they stay in that what we call pre-virus state, so stay just with increased risk without developing the cancer. So that is a very novel approach Again, I'd rather have a patient be a pre-vivor than a survivor. So we're very happy to have that clinic on board for those who need it.
That is pretty amazing, actually. And I agree with you that whatever you can do before, it makes a huge impact, especially on the outcome. So I think it's amazing, and that we don't know as much as we should. So thank you for bringing awareness to the breast prevention clinic. But let's go back to the myths, because we still have a few myths to dispel.
Yes.
Number 10 is regarding alcohol consumption. Is it true that drinking more alcohol raises your risk of developing breast cancer?
The answer is alcohol itself as associated with breast cancer, no. We know there's a direct link between alcohol consumption and liver cancer, but certainly the key word is moderation. When it comes to alcohol, because it's good to have a good, healthy lifestyle. So it's one of those lifestyle modifications that if somebody's drinking too much, they might need to modify. But the other component is if you're going to drink alcohol, we think that the red wines are better because they contain phenolic acids, which are supposed to be protective against breast cancer. So keyword moderation. If you're going to drink, try to drink a red wine, because it might be protective, but no association with breast cancer risk.
That's very interesting. And also always drink responsibly in moderation, and also following any guidelines that your doctor might give you, because each person is an individual and you might have other underlying conditions. So always bring it up with your doctor. Don't forget any details when you're filling out your history, your habits, what you enjoy, what you don't enjoy. I think it is so important so people realize that your doctor's your friend. They're your ally in this. So the more information you give your doctor, the better guidance that they can give you in assessing your risk and any other lifestyle changes that you might need or might not need. But if you don't tell your doctor can't help you really.
Absolutely. I think I couldn't agree more with that comment, Jeanette. We're here to help our patients and to guide them. Life is a journey and so is your health. And the same way that we depend on the patients to give us information, then we can empower the patients to better take care of themselves. But if we don't have all the proper information, we can help.
Super important. Now, there's another myth, and I see this question coming up, and a lot of people actually sharing what they have been experiencing, what their thoughts are, and it's regarding breast implants. Does having breast implants increase your risk of developing breast cancer, or it is not a reality?
Yes, so happy to inform that there's one type of implants, those that are texturized, that over the years have been shown to have an association not with breast cancer, but with a type of lymphoma associated with that specific type of implant. But overall, let it be saline or silicone, have been released from the moratorium in terms of having any link to the increased risk of breast cancer. But what women should know out there who have implants is that when they get their mammograms, the technicians have to modify the technique because they have to displace the implant so then the radiologist can see the breast tissue by itself. So they have to modify the technique slightly. So then the radiologist can clearly see the breast tissue that is above that implant when they do the mammogram or the ultrasound. But there's, happy to say, unless it's a texturized implant and the association of that breast cancer related lymphoma, no link between breast cancer and implants.
Okay, so that is more information to empower our viewers to make the choices that they consider best for them. But at least know the science, know the facts, and that way you can decide accordingly. I think this is very important, and also because I see a lot of questions regarding mammograms and implants, and you just addressed that on how the technique basically is modified, but it's not a problem. It's not that you can't get an accurate reading with a mammogram, correct? The mammogram can still diagnose anything that can be abnormal, even if you have the implants, correct?
Absolutely. So there is no excuse not to get a mammogram if you have implants in place. And if there were any issues pertaining to the implants, sometimes we might need to do additional studies like an MRI, magnetic resonance imaging. But again, the standard of care for breast cancer screening is mammogram, sometimes coupled by the ultrasound. And in some patients, we might order a magnetic resonance imaging or MRI for more information. But implants is no excuse not to have your mammogram out there.
Good to know. And finally, this is another myth that I think needs a lot of dispelling, and that's why we have you to give us the facts. Do lumpy breasts predispose you to breast cancer?
Yes or no? Lumpy breast, otherwise known as fibrocystic breast changes or fibrocystic breast disease, does not increase your future likelihood of breast cancer. But what I've seen over the past 28 years is that it becomes really difficult for a woman with lumpy breasts to know what's normal for them or not. So again, the importance of being familiar with what's normal for you, to know your body, so that if all of a sudden the little lump that was there hasn't gone away, if you haven't had your period, to go seek that medical attention. So again, be vigilant, know what's normal for you, but fibrocystic changes do not increase the likelihood of breast cancer.
Okay, that's great information. Now, we received a question which I think is super interesting because I've seen it and I don't know whether there's a myth, a reality. So I'm going to use your knowledge, Dr. Mendez. Is it normal for your breast or armpit area to hurt if you no longer have your period?
Well, some women, what might be happening is might have what is called accessory breast tissue. So some women may have additional breast tissue in the area of the axilla or the armpit. So even though they do not see their periods anymore, that area will still be hormonally sensitive and might cause breast pain. However, if they feel a lump in the area of the underarm, or if it persists and it doesn't go away, they should seek medical attention because, as we said, breast cancer does not always present in the breast itself. And it could be the first manifestation that something is growing in the area of the axilla or underarm, and they should have that checked out if it persists. But for some women, it might be normal if they have what's called accessory breast tissue.
Okay, and now I have another question. Let's say that we do a self-assessment and we might consider ourselves at a higher risk than average at developing breast cancer. So what should we do? Should we go to the breast cancer prevention clinic and get some genetic counseling or genomic information? What should we do, Dr. Mendez?
So number one, know your body. Number two, know your family history. Because certainly, even though I told you most cancers are sporadic, 85%, 5% of women might have a genetic predisposition in their genetic makeup. And 10% of women might have a family history with no identifiable mutation. So really important to know those two things. And also know when you felt those changes in your body. Remember, it's normal for the woman, if you are mid-cycle, to start to experience some breast tenderness or some breast discomfort, for the breast to get engorged because you're about to have your period. But then it's normal for those symptoms to go away once you start menstruating. So again, depends upon when the woman felt the area that was of concern, and then whatever is their risk. And if you meet any of that criteria, then yes, either a benign breast clinic or a breast cancer prevention clinic would be a good place to start for that initial evaluation. First, make sure clinically that there's nothing of concern. And then by getting all the added information about family history and any of the imaging reports, then we can escalate and stratify the risk for that given individual. But as you said, it's a very personal story. And everybody has to be individually treated, given all these factors and taking everything into consideration. But we're happy that we have all the whole spectrum we can cover here at the Miami Cancer Institute.
which is really useful to know. Now, regarding risk factors, I've also seen, depending on the types of cancer, weight can also be a factor. Does being overweight put you in a higher risk category for developing breast cancer?
Yes, not only breast cancer, but any type of cancer. But when it comes to breast cancer, we know that most breast cancers are hormonally driven, meaning that they respond to the estrogen and progesterone in our body. Even if you are postmenopausal, you're still producing the hormones. So it turns out that the more obese somebody is or the more overweight they are, the higher the estrogen levels, because the estrogen deposits itself in the fatty cells. So we know the estrogen levels will be higher, and then those women will have that as an added risk factor. And hence, yes, obesity has been associated with higher likelihood of developing breast cancer. So that's what's important, to maintain a healthy weight and an active lifestyle, because that helps reduce those risks.
Again, empowering information. Dr. Mendez, one final tip to all our viewers, because I think you've done a tremendous job at actually dispelling the myths, but do you have any final word of advice for our female viewers?
Yeah, well, I would say to the women out there, empower yourselves with information, know your body. If you see something, say something, follow the screening guidelines, because early detection makes a big difference in terms of your outcome. And don't be shy about it, because we have to take our breast seriously, and doing the exam and knowing what's normal for you, it doesn't cost anything. And we had great outcomes with early detection. So go get your mammogram if you need one, and don't be shy, and protect yourself.
Yes, I also have my mask. We need to protect ourselves. We can't be scared of getting our mammograms,
Yes.
because right now all of the health precautions are in place. We wear masks to protect not only ourselves, but to protect others. And I really feel this is a very important message. Women need to be doing their yearly checkups. And if you are over 40 and at an average risk, you have to be doing your mammogram, but always consult with your doctor, because your personal and family history can actually make their recommendations change. And maybe you need to start earlier, but don't be scared. Being proactive is something that you can do to feel more in control, and it can empower you. And Dr. Mendez, I can't thank you enough for all the information that you have given us, for everything that you're doing. And could we repeat what all the special promotions that are being done at Baptist Health South Florida during the month of October?
Yes, so they have discounted rates for screening mammography, and certainly we're following all the COVID-19 guidelines. So please, viewers out there, take advantage of these special offers. And during this time, to get your mammogram done, it will be done safely, and it would be worse not to detect something in a timely manner. So don't let your fear paralyze you, and wear your mask when you come.
Yes, super important. And also, even if you don't have insurance, you can get a mammogram. You can get more information at baptisthealth.net/breast health. So please take advantage of that, because your health is the most important thing that you can take care of. Dr. Mendez,
Yes.
Thank you so much for being with us. May you continue helping so many women with everything that you do every single day. And I would like to invite everybody to consult the clinic if they need help with prevention, if they need help with treatment. The Miami Cancer Institute does a tremendous job. Thank you so much, Dr. Mendez.
Thank you for having me. Thank you.
And we will continue reading your questions at the end of this broadcast, and we will pass them on to Dr. Mendez. Thank you so much for tuning in, for your comments, your questions, and please feel free to share this information with all of your friends and family, so that way you can empower them with facts and not with myths. Thank you so much. I'm Janet Kaplun, coming to you live from the Baptist Health South Florida newsroom. Thanks for tuning in.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.